Rotate.
Just rotate it. No, we're not going to fit it.
Oh, yes, we can. Wait, hold on.
Hi.
Hello. Okay, how do we tighten?
Like that. Yep.
Okay. I'm not here alone.
Oh no.
Hello.
We're three heads. Okay. We're going to make this happen.
All right. Thank you for having us at your lovely abode.
You're so welcome. Thank you for coming.
This week we have Dr. Kat Vigo, physical therapist specializing in obstetrics with us. Yes. And thank you very much because you have a newborn baby.
Yeah, I do.
And she's
6
napping.
weeks old tomorrow. Oh, goodness.
Yes.
Napping.
So we are, my leg is hovering down here.
Yep, that's
We're all kind of sitting on top of each other to make this happen for you, and I've got my arms around these ladies. Okay.
We love each other.
So we wanted to have Kat on the show, Dr. Kat on the show today, because a lot of women experience different issues through pregnancy. And when I met you, I found out that a lot of it is unnecessary.
Right, yes. Treatable, preventable.
So there's a few questions we want to talk about that might help our viewers, whether they are not pregnant yet, or they are currently pregnant, or maybe they just had their baby.
Yes.
So let's dive right in. Is pain in pregnancy normal? What's to be expected? And when is it not normal to keep dealing with pain?
Right. So I love that question because a lot of my patients come to me by the time they're in severe pain, in tears, already missed work, and they'll say to me, their story will start out with, well, I had the normal pains around 20 weeks. And so I stop them right there because it's so important to me that women understand that no amount of pain during pregnancy is normal. So there's no amount of dysfunction or pain that you should deal with. So basically my advice or my answer to that question would be that as soon as you start to notice that you are having pain or dysfunction, meaning you can't walk well, you're falling, you're not able to maintain your bowel and bladder, any of those body parts that used to do this and now they don't do that function, you should go see a physical therapist. So I also want to follow up with that and say, pregnancy might not be your most comfortable time of life, so I don't think you should expect to feel like you're 17 again and have super energy and every joint feels fantastic and the stretching of your stomach tickles. It will be uncomfortable and you might have difficulty managing your body, but you should not be suffering. Does that make sense?
Yeah, absolutely. Okay. Absolutely.
What kind of issues specifically, what kind of pains are we talking about that you can help with specifically for these women?
And I wanted to back up because you mentioned that if a woman is pregnant and she starts noticing that she's having issues with incontinence or with pressure or with pain, that she should go see a physical therapist. But what I found out when I met you is that you actually specialize in obstetrics.
Yes.
So I know that's not on our list, but I'd like to know more about that because there's lots of physical therapists, aka PTs, everywhere. Yeah. So I'd love to know what is the difference.
Right. So that's a good point because before I specialized, I was a PT for like 5 years, and I would have been very nervous if a pregnant woman came in and said, "Oh, my back hurts or my knee hurts." I would be like, "I don't want to make your baby pop out." Now with that obstetrical background, that education and those continuing educations every year and the books that I read and all that, to be enveloped in that world, I have the background knowledge to be confident that I can work within safe parameters, that I know what advice to give them as their pregnancy progresses or once their pregnancy is over and they've had that baby and they're in recovery. So all of that background knowledge applies to physical therapy. So basically, yes, you want to find, we would either call ourselves pregnant and postpartum specialists, specializing in obstetrics, or women's health. Sometimes the category is seen as pelvic floor physical therapists, and those are all like specializing in that world.
Excellent to know. Okay,
Yes.
very good. So yes, going back to Martha's question, what kind of issues can you help with?
So basically, PTs are neuromusculoskeletal pathophysiologist. So what that means is anytime the nerves, the muscles, or the bones, or how those three groups interact with each other fail, then we can step in and help correct. So basically it presents like back pain, neck pain, shoulder pain, any kind of nerve pain. So like someone would say sciatica, or like a ligament that's dysfunctional, like your round ligament pains. I've treated women, pregnant women or postpartum women, for plantar fasciitis.
Wow.
So their feet are bothering them because of all the physical changes. And again, like physical therapists would treat plantar fasciitis. So I have experience with all kinds of people who have had foot pain, knee surgery, you know, like neck surgery. So I can apply all of those skill sets to that pregnant body or that postpartum body. We also treat conditions, like I said before, like walking disorders, balance disorders, anything in the pelvic floor area. So when those organs are not where they need to be, like prolapse, and you know, you have some your bladder or your colon pushing down on your vaginal walls, painful sex, inability to orgasm is actually something we would work with. Any woman who has the leaking, you know, they can't maintain their continence. And also, what else was I going to say? Something important. But that's okay. Those are mainly the things that we would treat.
Okay.
Excellent. So when you're thinking about the various pains and discomforts and stuff that a lot of women feel and they just kind of suffer with because they don't know any better, they associate it with, like, that's just pregnancy. When we have that, those pains and those issues in the pelvic area, how does that impact a woman's birth? Like the physical act of her birthing her child?
Yeah, so that labor component and the delivery. So it depends, because every woman might present with their own issues. But one thing I can touch on that I think is very important is that, so a woman who has pelvic pain, so pain with sex, inserting a tampon, or just like sitting and they're having pain in that area, they sometimes have tight pelvic floor muscles. So you know how like a lot of us will store our tension here or in our shoulders? Some women store their tension in their pelvic floor. Or they're just Kegling like crazy and they don't realize that they're shortening that muscle group, and now you go to use it and it has this much motion and you're like, oh, how come I can't curl a 15 anymore? Because you're like here, you're stuck here and your muscle fibers are shortened. If they have some of those symptoms, then, like you guys know, you have front row seat to this situation, those pelvic floor muscles have to stretch to their maximum capacity for that baby to pass through.
Right.
So if they have, just as an example, tight pelvic floor muscles, it'll tuck their coccyx under, so their sacrum will be kind of closing that window that the baby comes out of, and it will shorten those other tissues. So the muscles will get shorter because they're contractile, but the other soft tissues are going to be tighter because they go with the muscles. The muscles are telling them to come here.
So that's going to feel like back labor too, probably.
They can have back labor. They could have some tearing at the front. Like they don't usually, you know, stretch completely. And they just have a hard time opening. And sometimes it can present like the baby will kind of rock back and forth as it's coming down the canal. So like for that specific patient, I wouldn't necessarily prescribe this for every woman, but for those patients who have tightened pelvic floors or their sacrum is tucked under, a women's health physical therapist could do soft tissue work in that area, release the muscles manually, and then also give them some breathing exercises or just some like more mind-body awareness exercises to help them actively lengthen that area.
Interesting. Okay.
So that baby can come out.
Awesome.
When is it the right time for a woman to come and see a physical therapist who specializes in obstetrics?
Yep. So
because you said most women come to see you when their pain has been unbearable for weeks and weeks.
And they're already suffering big time. So ideally, they could come as soon as they find out they're pregnant. We could do an assessment. We could say, these are the risk factors and these are the things you're currently looking at. I want you to do this, that, and the other. I'm going to do this, that, and the other to you, and you're going to do great. Right now, the system is not set up like that, right? We don't get healthcare until we break. So in this current system, what I would say is as soon as you start to notice a pain that does not go away within a couple of days, a dysfunction, so you're like, wow, I'm really walking weird, or I feel like my knee's gonna give out, you know, my balance is off, or if you notice severe pain. So if you have that 10 out of 10 pain, it doesn't matter that you didn't have it for 4 or 5 days. Go get some help.
That makes sense. Yeah. Let's see.
So we're talking about women who is not pregnant. So women who are not pregnant yet but are planning to or hoping to become pregnant within the next whatever, a few months to a year, whatever, would they benefit from obstetrical PT before even getting pregnant?
Yes, absolutely. So that again would be like a wellness visit. And ideally what we would do is educate that woman on how she can maintain her core strength, because a lot of women think, oh, I'm pregnant, I can't exercise my stomach, let me just let it hang. Or I can't even use my postural muscles in that area because I'm gonna squeeze my baby. So it's important for them, before they get pregnant, to have the strength in their core. And I would love to teach them to be connected to their pelvic floor muscles. So this is an area of the body that we can voluntarily control. So many of us sort of disconnect from it, or we just don't know how to maximally, ideally control it.
I'd love to know though, can you touch on whether PT can help with infertility?
So there is a lot of exciting work with that, and we are coming up with data to support it, but I absolutely believe that we can. It's just in the medical world, you can't really claim something until you've got all those years of research and it's been processed and you run the numbers and you support the numbers. But as far as case by case and things that I've seen in this world, yeah, absolutely.
And sorry about that, like impromptu question. I have like 30 questions in the back of my head that I'm ready to like throw at you.
I know, me too. I'm like, wait, I wonder if we have time. I want to ask this. Are there any tips or suggestions in general for postpartum moms who have gone through this journey already and now are on the other side of this and they want to, strengthen or heal or whatever their pelvic health at that point?
Yes, so I feel so passionately about this, especially now because I just did this 10 minutes ago. You were there. And there's a few things that I wanted to touch on for that. So first of all, in those first 6 weeks, we are instructed to rest, to bond with our baby, and to minimize our activity, which is super important because you've been through a marathon and you deserve that rest and you should absolutely bond with that baby. What I want women to understand is it's also okay to do gentle stretches, to start to reconnect with your core because it's different now and you don't have that firm baby in there, so it's not taut. So now there's empty space in there. You need to reconnect with your pelvic floor. Maybe you've had trauma. Maybe you had a fantastic delivery, but you just feel so overstretched you can't connect with it. So first of all, there's a few things you can do to improve your body awareness and to just be comfortable. Like I'm sitting so much to nurse the baby, then to feed myself, and then to nurse the baby, and then to, so it's a lot of sedentary activity. Stretching is so important because you just ache, The other thing I want them to understand is, kind of on the flip side, once you get to that 6-week mark and you're supposed to be like magically healed and you're all of a sudden all better, go from sitting down for 6 weeks and laying down and doing nothing to your normal exercise activity. And all of us women's health physical therapists are like, no, please tell these moms that they need to slowly reintroduce their poor body to regular activity, then to minimal exercise, and eventually 6 months, 9 months, a year, get back to where you were before. If you were a super rock star athlete running, straining your body, okay? So that slow progression, that's rehab in general. That's what physical therapists do. We get you from that surgery back to normal life. We get you from, a stroke back to normal life. So it's like, that needs to happen for postpartum women too.
Wow. Okay.
It's not just like a green light, go.
So I have a question related to that. Like, what about, I have a lot of mom clients who, I've been their doula and, they're very fit and they're not 6 weeks yet and they're already hankering to do stuff. They want to do stuff. And what's that line between, okay, do stuff, but where do they start and how much stuff is okay? I always tell them,
how much
monitor your bleeding and obviously gauge how your body feels.
Absolutely. So that's excellent advice, actually. Excellent advice, because you really want to be listening to how your body is doing in that moment. There's no amount of like, oh, if you were running 10 minutes before you had your baby, therefore you can, like it just depends on how your body is feeling that day and how it responds to activity. So as a general guideline, I would say no impact. So that's both feet up off the floor at one time is a no. And then I would say anything where you have to, what we call Valsalva, to perform that activity. So bearing down, or if you watch yourself do the exercise and you're like, oh, that form is not good, don't do it. And honestly, resistance, I would not do resistance exercise for 6 weeks. So that's any, like maybe a TheraBand, but no weights, body weight, anything like that. I would really avoid it.
Just stick to more gentle stretching. And
you can do
some walking.
Stretching, walking if you feel comfortable. So if you have any kind of perineal body tear and you have basically stitches, the doctor says, oh, I gave you these stitches. That tiny little area of tissue transfers weight from one leg to the other. You can't just wrap it up like a foot and go on crutches. Like, it's a postural muscle. It has a lot of work to do with sitting and walking and transfers. Like, women know who like go to roll over and you're like, oi, chihuahua, that hurt. So you have to make sure that you're protective of that area. And remember, a lot of women are disconnected from it. So they might be really uncomfortable and think, oh, my bottom is kind of numb right now. Or I have like this, my skin is healing. It's not just skin. Like, there's other things going on there, and you have to really be aware of it and give it that time to rest. Think of that sprained ankle. Wrap it, rest it as much as you can.
I want to go ahead and say that I think that we're going to try to do a second episode with Dr. Vigo at some point in time. Because I know I've got like 30 questions for you.
Me too. Yeah.
I love it. So, but thank you so much for having us in your home.
Oh, my pleasure. Yeah.
And we hope that our viewers got something productive out of today's episode. If you have any questions that you would like to ask our physical therapist, Dr. Kat Vigo, please either leave them below or feel free to send a private message to either me or Martha, and we'll get your message over to Dr. Vigo for you.
Absolutely.
But thank you so much.
Thanks for watching.
You.